All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we're with beautiful Bianca, and she is doing one of my newest treatments, SKINVIVE. And this is one of the treatments that I love. We call this the Skin Glow treatment. This can be done as a microneedling treatment, in between your lasers, with facials, or as regular just glowing. And we're doing it in a very unique way, okay? I've been doing this for years, actually, in the Middle East with a product called Volite, which is basically what this is. SKINVIVE is a liquid form of hyaluronic acid, a very thin version, and it goes right to the superficial part of the skin. And the way in which it's taught in America doesn't get us as superficial as we really want to be to truly improve the hydration and the complexion. So we're using a special technique here. And I want to go, I know it's tough there, we're almost there, to not only kind of tighten, but also microneedle in the little blebs. And you guys see there's little blebs that are popping out. We want that to occur because that means that they're going in and hydrating and then popping out. A couple more, almost there. A few more. Doing great. And we do all the areas for hydration. And this is to not only make the skin look more luminous and have more radiance to it, but it hydrates it and plumps it. So if you have fine lines and wrinkles, darkness, discoloration, I'm gonna go along the chin now, okay, or large pores, redness, all that stuff improves. This is like an internal chapstick, you guys. And
I want to know what the F is this? Dean's on here.
Yes, we're almost done though. We're halfway through. It's very good.
This is one of the newest treatments.
So this is called SKINVIVE, you guys, and it's done in a very unique way. It's a mesotherapy treatment for the skin. This uses a liquid, very thin liquid form of hyaluronic acid to improve the quality and the texture of her skin. Okay, and we're gonna do little teeny blebs into the surface of the skin.
Dean said she's so stunning. I want to do SKINVIVE.
I know everyone does. Okay, take a breather. And it looks like we microneedled. You guys can see, because we're doing multiple needle pokes in one needle in one insertion point. All right, let's get through it. You can do it. 2 more minutes on this side. We're almost there. You guys see
How much does something like this cost?
this is going to range about $1,000 to $2,000 a treatment. Just depends on how many of the syringes we use and how many areas. Usually I like to do face and neck, so it's a few $1,000s to do the treatment. But what you do is you do a couple sessions in a row, and then you do it every 3 to 6 months, 3 to 4 months. If you do it with lasers, like today we did with acne scar treatments, it helps enhance that result. And it's really important you get into the skin, we get that little bleb that comes out, a very small amount. That helps us, and you guys can see all these little dots right here. See them right here? All those little dots are superficial hyaluronic that is now going to hydrate and plump her skin. Okay? And I'm gonna go a little closer to the eye just for a couple pokes. Now, SKINVIVE technically is on label for just the cheek, but we do the entire area because, again, this is a liquid form of hyaluronic.
What is this procedure called? I just joined. It's SKINVIVE. Dr. Emer just told you. The king of off-label.
Yes. So now we'll go to neck.
The neck?
Do you want to do jawline?
Did we do around here?
Yeah, I'll do a little more too.
Yeah.
But look up, I want to go along your jawline.
What is the downtime, Dr. Emer?
What?
Downtime?
No. Is minimal. I mean, she'll look like, she might have some bruises and some little pinches because it's like microneedling. You want to define that jawline. So definitely little pokes here. And this just enhances everything. So we just did below our endoret rejuvenation. Now on the surface, we're doing our hyaluronic, and she's just gonna glow like in the next couple of days. So this is something where if you turn to the right a little bit, if you want something that has minimal downtime but that has a lot of impact, immediate glow, and improvement in texture and tone, this will do it. And when it's a really thin, do a little bit more in that area. When it's a really thin filler like this, you guys, you're gonna see a little bit.
Is that SKINVIVE?
Kinda
Yes, it
pops
is.
Out.
Providers around here asking.
Of course.
We've done it for a while. It's our first time showing it. There's some secrets.
Where is the rehab? Perfect. Just do a drawing because I want to get a little more under drawing too. You guys see we're really enhancing everything, especially along the jaw and tightening out her lower face because that's where it really bothered her. But the on-label use of this is not a very appropriate way to use this treatment. You don't get as good of a results as you do when you do this, which is why I'm showing you guys now for the first time. I'm gonna do a little longer hairline, then we're done. The hairline will actually help the PRP from the growth factors from the underet. Perfect, done. Okay. And that is our SKINVIVE. Now we want the blood on here a little bit for tonight. So we're gonna rub that in. She could apply Emer skin if she wanted to, or her emergency kit. There's a lot that we could do. But overall, you guys, in the next day or two, you will see amazing glow, minimal downtime, just those micro punctures and some plumping, and that's it. So that's SKINVIVE. Bye, guys.